from the literature. Evidence-based practice is conscientious. In other words, you're choosing it. You're not just letting it happen to you. It's active. It's explicit, meaning not just it happened, but that you chose specifically to do it. It's judicious, meaning there's a component of justice to it. Use of current best evidence with clinical expertise and patient values to make decisions about the care of patients. Could be a community, could be an individual. Patient-centered. Do the families matter? Sure. They provide evidence. They're part of the system, but it's patient-centered. Not what the uncle wants. All right? Not what auntie wants. What the patient wants. Evidence-based nursing practice is the process of shared decision-making between practitioner, patient, significant others, which is just the fancy American word of saying husband or wife or aunt or uncle, or we say significant others, based on research evidence, the patient's experiences, not just your experience. When the patient says, you know what, I'm fine, you walk in and say, let me adjust your pillow and set you up. And the patient says, you know what, I like to lay back. And you say, no, it's good for you. Get you up and get. And he's like, I laid in bed before. I know how to lay in bed. Stop moving me. Stop touching me. That's their experience, right? You can still care for them. There might be things you need to do, and you still want to do them, but you will include patient experience and preferences, clinical expertise, and other robust sources of information. And it's that other robust sources of information, which means we've got to disseminate. We've got to share. It's both a process and a product. Evidence-based practice is the way you do things. It's also the end product of what you're trying to get to. It requires that evidence which is produced is also applied. You can't just simply do a study. You got to publish it. So hence, publication, dissemination, sharing what is learned